how would you describe to people what um, Oriental medicine is? What's the concept behind it?
Yeah, Oriental medicine. The concept is finding balance within the body. It's a big question, and and it requires an answer that usually takes some uh, choreography before you answer the question, if that makes any sense. But um, but it's about basically harmonizing the body, harmonizing the mind, body, and spirit. Um, and then you can take it to, you can specialize in different aspects of Chinese medicine, like allopathic medicine specializes in allopathic medicine or in different parts of allopathic medicine. Like neurology or you know hand foot doctor or optometrist, ophthalmologist, whatever. And so my specialty is um, helping people recover from chronic illness. Basically, bottom line, neurological disease, autoimmune disease, cancers, um, and any type of unnamed chronic illness. Um, that's
Like
that's what I do.
autoimmune.
Yeah, autoimmune.
So is how do you go about doing that? I know I'm sure that's a loaded question, but for the layman,
Yeah.
how do you go
Well,
about finding the cause?
uh, it's it's so basically you understand what you got to understand what the immune system does when we talk about autoimmune. What does the immune system do? It kind of helps keep, one of the things that it does is it helps keep microbes under control in the body, right? And environmental toxins. And when the body chronically fires with immune reactions, such as intermittent episodes of inflammation, flares, skin rashes, um, you know, uh, joint pain, roaming joint pains, inflammation of the brain, such as brain fog, short term memory loss. You can have other immune like reactions, such as numbness and tingling in the extremities, arms, face, head, anywhere in the body, feet, legs. Um, you can have other immune reactions such as fevers. They call it an interleukin 10 response. Inflammation, I believe, is an interleukin 6 response. You have, um, um, you have inflammation in other areas, like you might have urinary retention, where when you go to urinate at times, the flow is a little bit slower than you think that it should. Then you go to see a urologist. What does a urologist do? They find antibodies that go after the tissues in the ureter or whatever, and they diagnose you with RA and they give you immune suppressants. They suppress the immune system rather than help the immune system. So, you recognize that autoimmune disease, you have the immune system is chronically firing. And so then you're like, okay, why is the immune system chronically and firing? Chronically and firing. Then if you're automatically aware of infectious disease, which I am because I had been through it, I have my own story. Then you think, okay, is this bugs or is this environmental toxins? Bugs meaning, is this a bacterial, yeast, fungus, mold, parasitic, protozoa infection, viral infection, or is it what's referred to as MSIDS, multiple systemic infectious disease syndrome? Usually it's the latter. Allopathic doctors, they will find, okay, you have inflammation, let's treat it as if you have fibromyalgia. Okay, we'll give you this medication to suppress the immune system so uh, you have less symptoms. You can feel better temporarily. Or let's say you have hip pain. You come in with, crazy debilitating hip pain. Realize that your TNF alpha, your rheumatoid factors are elevated, and you have RA. Okay, so we'll just give you some immune suppressants So the hip pain will become like Humira, and the hip pain will be less, but then other areas of the body start showing up with other weird things. You might start to have cardiovascular issues, you might start to have pulmonary issues, you might start to have neurological issues, or what have you. Because when you suppress the immune system, if you have a chronic infection, then the chronic infection proliferates at a faster rate. And when it proliferates, it infects different areas of the body and starts to present in different areas of the body. And then if you keep going through the allopathic process, then you're just provided more medications to help manage these other places of challenges.